Hi, my name's John Foss. This is my boy, Errol. He's a Cocker Spaniel and he's sable, and I run his webpage. You can probably hear another monster in the background. This is Errol's brother Duncan, who's a absolute crazy creature at the minute. He's only 10 weeks old and he's a little mudgy baby at the minute, so he's a whirling dervish. This is Duncan. I've been asked today to talk about living with psoriatic arthritis. I also have a number of other conditions, including fibromyalgia, and I've just been diagnosed with osteoarthritis as well. I've got degenerative disc disease in my spine, and I'm also being investigated for another condition, which is a rare lymphatic disorder, all which I've been diagnosed with in the last couple of years, so it's kind of come as a bit of a shock. However, I'm dealing with it as best as I can. But today I'm going to talk specifically about psoriatic arthritis and what it means for me. So psoriatic arthritis is an arthritic condition that's triggered by psoriasis, basically. So quite a few people that have psoriasis, a percentage of those will end up getting psoriatic arthritis. And it's where, in my condition, it's where the lining of the joints is attacked internally by psoriasis, which causes inflammation and pain. And because the air's not getting to it, because it's inside your body, it doesn't heal or scab over like psoriasis would. So it means it just stays red and inflamed, and therefore I get lots of fluid on the joints, and that causes swelling and lack of mobility. I've had a particularly bad flare-up this year. Well, it actually started in October 2017, when my right knee swelled up so badly that I couldn't walk very well. I was on methotrexate, which I think has been discussed on the Foot of Our Stairs blogs before. It's basically a treatment that they use for cancer patients, but it's in lower doses for people with psoriatic arthritis. It kills the white blood cells, it makes you feel quite sickly, and it's just a poison basically. It's not very good. It can affect your liver, it can affect your bone marrow, can make it toxic. So you have to have 3 monthly blood tests for those. I'd been on methotrexate for about 3 years, initially on tablets and then on injections. And once I went onto the injections, the side effects kind of escalated to the point where I felt quite ill for most of the week. Sickly and just not feeling great, and towards the end of the time I took methotrexate, I had a problem with my liver function. It started spiking, so that basically meant that they wanted to take me off it because they thought it was damaging my liver and could cause permanent damage. So they took me off methotrexate in September, October last year, and 2017. And then by January, my mobility was really poor. I went to hydrotherapy to try and improve that, which didn't really work for me. So they tried me on a different medication, which is called cyclosporin, which is an arthritic medication. I was really ill on cyclosporin. It kind of gave me chest pains and made the ends of my fingers go blue. I was having problems with circulation. And so they took me off that within 2 weeks. It just obviously wasn't the right drug for me. So then I was off all medication for quite a period of time. So my external psoriasis became worse, which was primarily affected across my forehead, in my eyebrows, across my face here. I had a big patch on the back of the head, which I'll try and show you a picture of now. And then I also had horrific swelling to the knee, which I'm also going to put a picture up now. Most of the time I've been in debilitating pain, and I've been on a walking stick for most of this year. In June I was assessed for biological medication, which my brother, who's got the same condition, had been put on about a year ago. I've been refused it a number of times because I didn't hit certain criteria, but for whatever reason this time, I think because I tried 2 of the major arthritis drugs, and I had swelling in more than one joint, along with some external psoriasis, which was kind of getting worse. So I've been on a drug called Cosentyx, which the longer name is secukinumab. I've been on that since November, I think. I started taking that. So far, so good. My external psoriasis is a lot better. I haven't got any very bad redness across here. It's still dry, but it's definitely better than it was. The other thing I was suffering from was pitting in my nails, which was very, very bad. So the whole of the ends of my fingers were so sore. So it's very hard if you hit your hand against something, or you were trying to undo a button, or anything that involved you using the tips of your fingers was painful for me every time I tried to do anything. That also has improved. I get them on the nails of my feet as well, and they're probably a little bit worse than the nails on my hand. But again, a marginal improvement. So the jury's out with this new medication at the moment. I'm hoping that I will see some long-term benefits. During the course of my knee being very swollen, I'd had a couple of procedures on my knee, which basically to drain the fluid and inject steroids into the knee. The second time I had that done, they withdrew 100 ml of fluid off my knee, which is probably one of their highest levels this year. They said that the record was 120 ml. When they did that and injected steroids, it gave me a bit more freedom of movement. But it only lasts about 2 months. I had that done about 3 months ago, so I'm hoping, because it hasn't come back as badly as it was in terms of the swelling, I'm hoping that the Cosentyx has kicked in, and that's keep stopping the inflammation from coming back. Side effects of Cosentyx are the psoriasis does improve, but you can become quite itchy, which I have noticed. It can make your nasal tract and upper respiratory tract more prone to infection. So sometimes when I wake up in the morning, I feel quite ill. I feel like I'm getting a cold or I'm getting flu. And normally within a few hours that tends to go, but first thing, I can feel quite odd. Other than that, I've not been too bad on the Cosentyx. The only issue I have is that I'm issued that medication by one hospital trust, and that hospital trust have just had their funding pulled for their biological clinic, so they may take me off that medication after waiting for 2 years to be put on it, which is obviously a bit of a nightmare. Doing lots of things when you're living with arthritis and fibro makes you extremely tired, and also you're in pain a lot of the time, so you don't sleep as well as other people anyway. The only way I can manage this condition is by resting at times. That is my best medicine, really. So when I go back to work, I've asked to take some hours that I'm due from this year forward for next year, and I'm going to use those to take days off strategically placed during the month to give me the most amount of time to rest, and hopefully then I can manage working again and manage the condition. So I don't want this to be too negative a post. You can live with the condition, and it is something that you can manage, but you have to be very aware of your body. I wasn't really listening to my body. I was just kind of carrying on thinking, oh well, I can deal with it. The best way of managing the condition is by ensuring that you rest. I've been told so many different things by people. When you tell them you've got arthritis, it's like, oh, my best friend tried spinach water with a hint of cinnamon. Try that every day in the morning, an hour before you go to the toilet. And so, just stuff that you think, well, okay, that might work for some people, but I've tried so many things, and, a lot of them haven't worked. So you become very skeptical, and also you get fed up with people that think they're doctors, and, they can give you the right diagnosis that this is going to work for you. Trust me, I know somebody that's done it. That might be the case, but everybody's individual, and when you've lived with the condition for 3 years, you kind of know what works and doesn't work. What has worked is not eating any processed food, but that's not to do with the arthritis specifically. It's more to do with one of the other conditions that I'm managing. So I do tend to home cook now a lot of stuff. The other thing about living with psoriatic arthritis is that it's a hidden condition. So people see you and think, oh, he looks fine, there's nothing wrong with him. I guess people have coined this phrase hidden disability, but I think it is a hidden disability in a lot of ways. Unless people can see your swelling of your knee if you're not wearing trousers, or they look closely at your nails to see the pitting, they can't see how much pain you're in and how tired you are. And I put on a bit of a front, so when I'm seeing people, I try and be energised. So when I do see people, I make sure it's when I'm in a good place and when I'm feeling up to seeing people. What has impressed me recently is the Versus Arthritis campaign. It's really good to see people being educated about different types of arthritis, and also that it can affect both young and old people. It's not, you know, an older person's disease, which people tend to assume it is. So I'm hoping this video will give a bit of insight into that, and I'm hoping that people can view it and think, well, I understand, you know, what it's like now a bit more, and how this person lives with it and what they need to do to kind of manage it. So thanks very much for watching the video, and if you want to have a look at Errol's page, it's Errol the Peril and Duncan Disorderly's adventure page on Facebook, and we tend to put a few posts about my condition and more posts about the boys because they're so cute. So thank you very much for giving me the opportunity to do this video, and I hope it's helped for people that are sufferers or people that want to understand a bit more about psoriatic arthritis. Take care.